The subject of human immunodeficiency virus, HIV, is one most Nigerians approach with caution. And though there are adequate awareness amongst Nigerians, the general risk perception of HIV infection is a mixed bag. Hello and welcome to another episode of The Last Mile with NACA. I am Adesuwa Osui. HIV was first discovered in Nigeria in 1985, but several years after, and scientific milestones achievement in the prevention and treatment of the epidemic, which has helped in reducing the spread and deaths. Is HIV still a threat? You're watching The Last Mile with NACA. Don't go away.
I don't see it as stress because right now you can live with it, have your partner, your family live with you, and then everybody's fine. The society is changing, things are not the way it used to be. So I think it's just one of those things. It could be headache. People die because of headache. People don't know they have the high blood pressure. So I just see it as one of those other illnesses out there. So
actually, I don't go lie, they fear me. And they just say it get very way we say if you drink, the thing go gradually. But really, I don't really sure whether it's true or not. That is why they fear.
Well, I don't really have people around me with HIV, but I think with the retroviral drugs, it is not more a threat. As long as you can manage it, it is not more a threat.
Because it's a deadly disease that eventually it will lead to death. So nobody wants to contact such disease. Yeah, so surely it's a threat to our society.
4 decades after the first cases were reported, there is still no vaccine or cure for the human immunodeficiency virus, HIV. However, with increasing access to effective HIV prevention, diagnosis, treatment and care, HIV infection has become a manageable chronic health condition, enabling people living with HIV to live long and healthy lives. Though the mode of prevention, treatment and testing deployed in Nigeria isn't too different when compared to the rest of the world, there are still concerns on how to decrease new cases of HIV among certain populations, which also begs the question, is HIV still a threat?
HIV is a threat, and it will continue to be a threat as long as individuals who carry the virus in their body are not aware they have the virus, or they are aware they have the virus, but they are not taking medication. But if everyone that has HIV today in Nigeria will know they have HIV and will take medication to check the virus, to make sure the virus disappear from their blood, and it doesn't leave their body to affect other people, as well as it doesn't get the opportunity to destroy their body defense mechanism, then we begin to say HIV is no longer going to be a threat.
The issue of sustaining the gains made so far has become a challenge in light of dwindling resources.
We have 1.6 million currently on treatment, and 1.5 million receive their treatment from support we received from United States government and the Global Fund. 100,000 receive their treatment from the support we get from the federal government of Nigeria. What we're looking forward is to have a situation where we reach a bridge, and that bridge is when we are very confident in our mind that over 95% of people that live with the virus in Nigeria are identified and they're taking medication, and we're closer because we're looking at reaching 1.8, 1.9 million, but reaching that bridge comes with responsibility also. The US PEPFAR program is not going to remain in Nigeria forever, and the Global Fund program also for HIV is not going to remain forever. How do you keep 2 million people on treatment for the rest of their life? Who pays for that treatment? And how do you get that services to continue in the absence of the big donors that support it at the moment is the challenge. And that is what we call sustainability.
Capital flight is also a major challenge as HIV treatment pharmaceuticals are not manufactured in country. Also, a reduction of available human capital are some of the impact of HIV and AIDS to Nigeria's economy.
If I put it simply, conservatively, it costs between 50,000 and 100,000 to maintain a person on drugs a year. It means Nigeria must be pumping in 170 billion thereabouts to maintain those people. We're not talking about building houses or infrastructure or anything, just to keep those people alive. And after spending that 170 billion this year, they must spend it again next year. That's how we continue to maintain them for the rest of their life. As of today, about 86,000 Nigerians get infected annually. Remember I told you there are 1.7 million. That 1.7 million is already costing us 170 billion naira. 86,000 again this year. That is times 100. You add another 8.6 billion to, and Nigeria being a poor country, you know what that means. That money should have been used to take care of that individual, build economic opportunity. So that's why we call it a developmental disease.
Even though over 90% of the population have knowledge of HIV infection and acknowledge the severity of unprotected sex and multiple sexual relationships in the acquisition of HIV, what is the risk perception of HIV infection among Nigerians?
Many people are aware of HIV. I can assure you, when people see you are talking about HIV, oh, I know HIV, I've even seen people who have been affected. That is true. There's about 98% awareness. People know about HIV. People have heard about it. And they've heard about it to the extent that they are tired of hearing about it. But guess what? If you pick an individual and you say, are you at risk of contracting HIV? It's not about wishing away. They will say, oh, God forbid, evil. It's not about God forbid, but what are you doing that predisposes you to it? Do you have multiple sex partners? Whenever you have sexual contact, whether with your regular partner or with a casual partner, do you protect yourself? And do you know how to use that protection adequately and correctly? You see, these are questions that seeks to evaluate individuals' risk. Many of us do not know that we are at risk. And those are the reasons that we keep having at least 86,000 people become newly infected.
We all have a role to play if Nigeria is to attain HIV epidemic control by the year 2030, as it is not a task for the federal government alone.
We've been having HIV around for the last 40 years. It's one of the longest disease that has remained on earth without a permanent solution. HIV doesn't have vaccine. HIV doesn't have cure. The best cure for HIV at the moment is prevention. If you don't have the virus, make sure you protect yourself and you prevent yourself from getting the virus. If you have the virus, then just know that things have changed and HIV no longer kills. HIV no longer makes you look sick, except if you choose to allow HIV to make you sick, to allow HIV to kill you, then that is a choice that somebody has made for himself. But whoever has HIV, go to the nearest facility where HIV services are given. They will measure the amount of HIV in your blood. They will start giving you medication, and they will start monitoring to see how the HIV is disappearing from your blood. So once the HIV disappears in your blood, we'll want to continue to make it at that stage to ensure that it doesn't show in your blood. If it doesn't show in your blood, it's not going to disturb you. It's not going to leave you to affect your loved ones, and certainly it's not going to kill you.
To the general public, the message is simple. Avoid risky behaviors that might contribute to the spread of HIV and AIDS in the country.
Well, you've heard it. HIV and AIDS is still very much a threat. So, play your part in supporting the HIV response. Avoid indiscriminate sex. Do not stigmatize or discriminate people living with the virus. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsuyi. Goodbye.